So we are very happy to kick off our first speaker today, and it's none other than Dr. Yo Tiju. And Tiju is a senior consultant with the Department of Cardiology at the National University Hospital, National University Heart Center, I beg your pardon. Also the director of Cardiac Rehab Unit at the National University Heart Center. He graduated from Yonglulin School of Medicine in 2004 with his MBBS, and also received his MRCP and Masters in Medicine in 2009. Eventually, he has in 2013, he received a specialist accreditation in cardiology, and then was a certified clinical exercise specialist by the American College of Sports Medicine. From 2014 to 2015, Dr. Yeo was also awarded a Ministry of Health training scholarship to complete subspecialty fellowships in cardiovascular prevention and rehabilitation at the Toronto Rehab Institute. Okay, and since 2019, Dr. Yeo is also a World Health Organization Ischemic Heart Disease Rehab 2030 Development Group member, and also the country representative for the International Council for Cardiovascular Prevention and Rehabilitation. And he's also a board member of the Singapore Heart Foundation. So his talk will outline the impact of heat on the cardiovascular system, and especially focusing on people that are vulnerable and at risk, for example, people that are athletes or they have occupational exposure. He will talk about identifying and the management of the spectrum of heat-related illnesses and mitigating strategies for this climate change. So without further ado, please welcome Dr. Yo Tiju.
Okay. Thank you very much, Dr. Goh Jor Ming, for the very kind introduction, and thank you SMAS for the very kind invitation. So besides what was mentioned earlier on, I also did 1 year of sports cardiology at St. George's University of London, which explains why I'm here and involved in some of the sports medicine topics. So today, let's just go, okay, this is my talk. HIIT and heart health in those at high risk, so quite a number of H's. Before we begin, let's have a look at this video clip. While watching, how many have actually seen this before online? Okay, not a fair number, but not that many, not everyone. So Jonathan Brownlee is one half of the two Brownlee brothers. He was leading in this World Triathlon Grand Final when he experienced heat stroke, actually. So you could see that he was actually disoriented. He couldn't actually move, and his brother came along. His brother could have went ahead and gotten won the event, but he decided to help his brother and literally tossed him over the line. So later on, it was reported that Jonathan Brownlee had heat stroke. And since then, I think if you follow his progress over the years, he says he's never been back to his peak. And every time he competes in a heat-related environment, he doesn't do very well. So this is just an example of how heat can affect even the most elite of athletes. So apart from that, okay, there have been many different types of news publications on heat-related conditions. So on the left, you see that TikToker's death after running a scorching half marathon. And then the upcoming World Cup, the organizers are very, very worried that both the players as well as spectators can be at risk of heat-related injury. There was more recent last year, I think, during a NDP National Day Parade rehearsal, somebody actually passed away. Of course, it was not attributed explicitly to heat, but definitely I would say heat is a contributing factor. And in Singapore, as what was mentioned earlier by Tai, there's a lot of occupational risk. A lot of our foreign workers, construction workers, they work long hours in the heat, and they are actually at very high risk of heat stroke. And finally, with climate change, it is not an assumption, but it's actually a given that temperatures will rise with time. So our exposure to heat actually increases and leads us to much higher risks. So today, I will cover the impact of heat, 1H, on HIIT in general, high intensity interval training, or you can look at it another way for active individuals, not just elite athletes, but active recreational athletes as well. I'll talk a bit on heart health and how impact of heat affects the heart, and also the high-risk individuals. So not just athletes, not just recreational individuals, but also occupational athletes, occupational exposure, as well as those people in the extremes of age, especially the elderly. So I'll go through a few definitions, which I'm sure the speakers will also reiterate. I have some local data on heat-related admissions, some global statistics, the physiological adaptations to heat, the impact of heat on the heart, how at-risk populations have impaired heat responses, as well as even medications have impact on how you regulate heat and how to identify the at-risk individuals. So for definitions, this is not the actual one that I'm going to show, but this is taken from a heat advisory, I think in 2023, put out by the National Environment Agency, that tells us, according to the wet globe bulb temperature, how to moderate your activities. But with regards to the medical definitions of heat-related injuries, by and large, you go by core temperature. So if the core temperature is low meaning below 40.5, all the way up to more than 40.5, that tells you the severity. And the second key important factor to take note of is whether there's presence or absence of key clinical features such as central nervous system impairment. So if a person can't think straight, there's some cognitive impairment, if their motor skills are affected, and that actually suggests a more serious condition like heat stroke. Okay, and of course, if there is actually organ involvement like muscle damage, rhabdomyolysis, that would be heat injury, and heat exhaustion is arguably the mildest form of heat injury. So let's talk about the impact of heat on health outcomes. This picture was taken from Channel News Asia, I think 1 or 2 years ago. They actually mapped out the number of hot days by the year 2100, 2100, yeah, in Singapore. So you can see that based on the carbon emissions, there are 3 lines. If we keep carbon emissions low, then our number of heat days don't rise so much. But if we don't, then potentially almost every single day will be a very hot day, which means the daily maximum temperature exceeds 35 degrees Celsius. So here's some local information. This is from Professor Marcus Ong and his group, who looked at admissions to the emergency department in SGH over a period of 12 years. Now, in Singapore, over 12 years, not that many admissions, just over 400, and the majority were male, but almost half were non-Singaporean. So that averages out to between 20 to almost 50 cases a year. And guess what? The commonest day of admission is on a Sunday. Commonest month is on December. And that actually corresponds to our Standard Chartered Singapore Marathon. So there is a huge spike in heat-related hospital admissions every year during the marathon date. And will probably be the same because that is where the risk of heat exposure is highest in the largest number of people. So of these 400 over individuals, half actually required to be admitted to hospital. So the other half were actually discharged from the emergency department, and 7% actually ended up in the ICU. So 7% is quite serious. And 1 in 200, or 0.5%, actually passed away by 30 days. So actually, it's very, very significant, these statistics. Now we go to a global scale. This is a large meta-analysis done in Lancet Planet Health. So 266 studies evaluated, and they concluded that every rise of 1 degree Celsius in the environmental temperature was associated with a 2.1 increase in heart-related mortality. So this is largely driven by strokes and heart attacks. Okay, heart attacks being a coronary artery disease. Not only that, there is also a significant 0.5% increase in morbidity, and that is covered by even out-of-hospital cardiac arrest, arrhythmias or abnormal heart rhythms, as well as coronary artery disease. And whenever there is a heat wave, the risk of people dying from heart-related problems increases by more than 10%. So of these 266 studies globally, who are those at highest risk? So those living in the tropical climates, those in lower middle income countries, the elderly, 65 and above, and surprisingly women as well. So let's talk about physiological adaptations to heat. So this is a little bit of a busy slide, but basically it tells you how the body responds naturally, so physiologically, to heat. I'm sure the other speakers will also go in depth, but I'll just do a quick one. So firstly, with the exposure to heat, the body actually increases the sweating. The whole point is to get rid of extra heat by compensatory mechanisms. So you sweat more, your flow of blood to the skin actually increases. So there's peripheral or cutaneous vasodilation, as you can see over here. So it allows more blood to flow and more sweat to evaporate from the skin. So with that, actually, the heart has to pump harder in order to transport the blood to the skin. And with that, heart rate goes up and the contractility of the heart actually increases in order to pump the so-called additional relative amount of blood from the organs to the skin. And that leads to dehydration if there's prolonged exposure. That leads to dehydration if there's intense exposure. The kidneys are also affected because what they do is, in the beginning, they limit, or rather, they would actually try and conserve the fluid or salt levels in the body in order to maintain blood pressure. Because if you sweat too much, if you lose too much volume, your blood pressure will drop. Then that's where the kidney comes in to try and retain the salt to keep the body blood pressure normal. However, if there is prolonged exposure and there is too much fluid loss, then the central circulation is actually affected. Everything goes haywire. The heart goes over time. Basically it cannot maintain the pumping function to push the blood flow to the skin. They actually try to compensate by shutting everything down. So in fact, when there's basically maladaptation, instead of the skin being flushed, actually you can actually become cool and pale, so the body is no longer able to expel heat in this manner. And eventually that leads to central nervous system adaptations or alterations. They are cognitively impaired. Now, a more specific explanation on how heat affects the heart. So this is a very elegant study from the Annals of Internal Medicine. So what they did was they got 61 participants, 20 who were young, healthy, 20 who were old and healthy, and 20 who were old and had established heart disease or coronary artery disease. So they could have had a heart attack before. They could have had existing coronary artery disease, at least 70% narrowing and above. So what they did with these 60 volunteers was they did passive cooling. They wore a suit and they used water to cool them to increase their core body temperature up to 1.5 degrees Celsius. So there was no, because this was a very controlled study, there was no exercise allowed, no caffeine allowed, no medications allowed. So everything was pure heat, from wearing the suit. So they found that with this exposure to heat, the heart blood flow or myocardial blood flow, in this case MBF, could go up to 2 times higher than baseline. So in a normal individual, that's fine. It's expected. It's a compensatory response. But in a person who has already existing coronary artery disease, existing blockages in the heart, this rise in the blood flow can cause that area of the heart to have less blood flow. Okay. So basically, if you have a blockage there, the blood is supposed to flow through, 2 times higher, but the narrowing blocks it. That area doesn't receive the blood it requires. Okay, so in 7 individuals, or 35% of the population of this study, it actually showed up as lack of blood flow, or what we call myocardial ischemia. Okay, of course, this is a very controlled study. This was ischemia detected on a scan. The individuals, the volunteers themselves, did not feel any chest pain, but in the exposure to heat was only less than 2 hours. So you can imagine if you prolong this, there could be worse outcomes. So I will need to speed up a little bit. So this is how does the heat response vary in at-risk individuals? So I'll talk about the elderly. So all those that we mentioned earlier on, for example, vasodilation, allowing blood to flow more to the skin, all these are actually, you know, reduced in the elderly population. The heart function is already low, stroke volume is low, the heart rate cannot go so high, so they can't actually get rid of heat as efficiently as younger people. And because of that, it actually leads to more strain on the heart, more strain on the kidneys, higher risk of kidney injury, and overall reduced heat adaptation. In those patients with pre-existing heart disease, you also saw earlier on, similar function happens, and they actually have increased oxygen demand. They have a higher risk, the heat has a higher risk of leading to plaque rupture and causing a heart attack. In fact, it even affects their gut, and it causes increased coagulability, so higher chance of your blood clotting. How about medications? So whether athletes, whether it's recreational athletes, whether it is just the general population, certain medications can be risky. For example, the beta blockers reduce vasodilation, slow down the heart rate, and reduce sweating. So all of these impair the normal adaptation to heat and lead to increased risk of heat-related injury. ACE inhibitors reduce the thirst, they don't top up, but they rehydrate. Antihypertensives cause vasodilation and higher incidence of low blood pressure. So this one is, another three medications for those with diabetes. Metformin can affect the gut. So basically the gut actually leaks out, certain substances that are harmful to the body. SGLT2 inhibitors can cause, diuresis, losing of extra fluid. And insulin injections in those people with type 1 or severe type 2 diabetes can also trigger heat production. How to identify at-risk individuals can be individual characteristics or can be the external demands. So basically, how do these cause increased risk if they are unfit? I just identified a few. If they have high body mass index, if they are having a concurrent fever or infection, or if they have pre-existing heart disease, all these add to the heart strain and higher risk of heat stroke. And of course, external factors like uniforms, like the multiple layers of clothing or equipment, carrying heavy loads, exerting themselves, not enough rest, or using stimulants or supplements can also increase this risk. Okay, so for athletes, you also need to look about things. Sometimes people take laxatives, for example, if they want to drop weight in a bodybuilding competition, for instance. Those with skin disorders, rash, can actually impair heat loss. And this one we mentioned earlier, once you have a heat injury, it's very difficult to recover and get back to 100%. So I'll skip this one. So in conclusion, we really need to, be aware of heat and the impact of heat on our heart and also on our health. We should look out actively for those who could be at risk. It could be anybody, whether it's an elite athlete or whether it is a general population individual taking medications. And basically, Sports Singapore and NUS has also come up with some strategies on managing heat stress. And with that, thank you so much.
Thank you so much, Dr. Choo. And for our next speaker, I'm very happy to introduce Dr. Choo Hui-Cheng, or as we know her, some of us, Dr. Kester. She's an exercise and sports physiologist, and her work focuses on field-based performance in elite athletes. All right, she works on understanding the physiological responses to thermal strain. And for this seminar, what she will do is she will actually share some of the field-based physiological monitoring conducted during Olympic test events, Singapore local races, and also the SEA Games, Southeast Asian Games. And her presentation will then explore what these findings can suggest about thermoregulatory strain, athlete safety, and also recovery aspects. And beyond characterizing heat strain, Dr. Kester will look to contribute to broader discussions on advancing knowledge in heat resilience, acclimation, and some practical heat mitigation strategies. So without further ado, I'll invite Dr. Kester to give a talk.
Thank you. Okay. Okay, thank you, Zhoming. Thank you, SMAS, for inviting me today. Okay. Okay, this is the title of my presentation, or rather a sharing. So, sports performance in a warming world, a few insights from Singaporean athletes. Oh, sorry, heat strain in Singaporean athletes, few base insights from the SEA Games, local competitions, and the Olympic test events. So the questions or the area that I hope to cover today is how hot is too hot for elite performance? What happens to our athletes' core temperature in the real world competition? And what does this mean for performance, recovery, and safety? So competing in the warming world we are definitely very aware that global temperature has already increased by 1 degree Celsius for the past decade, and it will continue to rise. And major competitions that our Singapore athletes are taking part increasingly occurring under hot, humid conditions. So there will never be a cold SEA Games. All our SEA Games are all in a hot, humid environment. And SEA Games to Singapore athletes is actually of high priority, even though it's not the same level of competition compared to the Olympic Games. So heat illness, risk, and performance impairment are growing concerns to us. And you can see from this figure over here, right? These are the records of core temperature, peak core temperatures during local competitions. We have the cyclist in the cycling time trial. That's only like maybe about half an hour worth of cycling, and his core temperature reached up to 39.8. And we also have our triathlete reaching peak core temperature of 41 degrees Celsius during a local competition. So you see all these three bands over here. We have the mild hypothermia, moderate hypothermia, and above 39 degrees Celsius, you start to see impairment in performance. Above 39.5, there is a risk of heat illness. So the myth, Singapore athletes are acclimatized, so heat is not a problem. I say this is a myth because even these two studies have already shown that even with a small increase in the ambient temperature, you see a decrease in the performance even in Singapore athletes, right? And performance decrement occur even though these athletes are used to competing in the heat. So this study was actually based off Singapore Marathon from 2015 all the way to 2018. They tried to map the same athletes across the different years of a marathon, and with 1% increase in the dry bulb and wet bulb temperature, you see a 7% decrease and 39% decrease in the net performance time. So that means with dry bulb temperature, there's a slightly smaller decrement, but when the wet bulb temperature increased by 1%, you see a huge drop in the performance, right? So the other study shows that even though these athletes managed to complete the race without any clinical symptoms, they still present with mild endotoxemia and also some immune palpitation. So even without any clinical signs and symptoms of heat illness, prolonged exertion in hot and humid condition can also challenge the GI and the immune function in athletes. So heat illness in elite competition, I'm quite sure that you guys were aware that Singapore has the chance to host the World Aquatics Championship last year, July. And open water 10 km swim was challenging. They postponed the race from morning to the afternoon due to the high E. coli level in the water. But that also present the athletes to a higher risk of heat stress, right? So some of the information were actually taken from the post-event medical seminar. So there were 24 heat-related cases reported, and is the highest recorded in the whole World Aquatics history. Before 2025, the highest was 5 cases, right? And the news from the CNA, you can see that actually 25 out of the 100 male open water swimmers did not complete the race. So there is increasing need for evidence-based heat management. Oops. And also this incident highlight that elite athletes are not immune to heat strain, no matter how well trained they are. So the heat performance paradox, so published studies have already reported that elite athletes can spend 39, the core temperature during the race can easily exceed 39.5. You see the figure over here, right? This was recorded during the 2016 UCI cycling road race held in Doha, Qatar. The air temperature was about 37 degrees Celsius. The humidity was 25 degrees Celsius. It was a hot and dry environment. And they collected the core temperature data from male and female cyclists participating in the time trial, individual time trial, team time trial, and road races. So some of the elite athletes, you can see more than half of them actually had their core temperatures above 39.5. And there were some cases where their core temperature reached all the way up to 41.5 degrees Celsius. Even though they did not find any correlation between the performance and the peak core temperature, the peak performance usually comes with a high physiological strain. But having said that, high core temperature does not mean that it's always pathology. The context does matters, but even though these athletes did not report any clinical signs and symptoms, does not mean that there's no physiological consequences. So I will share some of the field-based insights from the Singaporean athletes. This is actually a collaborative effort between HBSI and the HRPC. And we collected data from 19 athletes, out of which 5 are female, between 9 to 20 of December 2025, SEA Games and in Thailand. So it was a hot and humid environment. And we selected our athletes from 5 sports: sailing, cycling, open water swimming, triathlon, and squash. So out of the 19 athletes, we managed to collect more than some of the athletes actually participated in more than one event. So total events in which we collected data was 15 events, but the total number of observation was definitely more than 15. Okay. During the competition, we measure their core temperature using the telemetry in an ingestible capsule. We also got the weather data from the meteorological website, and we managed to get the race performance data and the duration. So out of the core temperature matrix, we analyze, we present the mean core temperature, peak core temperature, the delta, that means the change in core temperature from the highest point they achieved during the competition and the start of the race. We also calculated the time they spent above 38.5 degrees Celsius, 39.5 degrees Celsius, and 40 degrees Celsius. We interested in this threshold because they identified with the mild, marked, and severe hypothermia. We also calculated the area under curve where they spend time above the 38.5 degrees Celsius. So these are the characteristics of the competitions. The event duration range from 15 minutes. This is actually a single squash game during the whole match to over 4 hours in the men's cycling road race. And the weather data are presented as follows. You can see that actually the cycling has the highest air temperature, whereas the humidity was highest during the open water and sailing. For the direct solar radiation, cycling and the open water has the highest solar heat. The table below is actually the performance scores where I normalize based on their ranking during the competition and the total number of athletes in the field. So the higher the number, meaning the better ranking they are in the field of a competition. So this is how our athletes get to. For mean and peak core temperature, the cyclists and the triathletes are presented with the highest core temperature. The change in core temperature from the start of the race to the highest recorded during the competition was cyclists and the open water, they have the highest delta. When it comes to the rate of core temperature increase, meaning how fast they get heat up, it was the squash player and the triathletes. So imagine that even indoor sport squash player, right, the rate of increase was actually higher compared to open water and cyclists. And quite important, I would also like to highlight that even though some of the athletes, we observed the highest core temperature during the competition, there were actually few cases where the core temperature continued to increase after the competition. So I think this indicates that we want to monitor our athlete, we should continue the monitoring after the competition. Then the time spent above the threshold, I'd just like to highlight that we have athletes from the cycling and triathlon that spend quite a substantial amount of time above 40 degrees Celsius. And in terms of the heat load, the cyclists spend about one hour above 38.5, whereas for the open water, even though there were no cases where the core temperature reached above 39.5, it was simply because of the duration they spent above 38.5. So that their heat load exposure was also considered high compared to the other sports over here. Okay, so we do have cases where our athletes core temperature reached above 40 degrees Celsius. In total, we have 5 cases out of all the athletes that we monitor during these SEA Games. So none of them actually reported heat illness. But does that mean that there's no physiological consequences? I don't think so. But at the same time, we know that yes, they did not suffer from heat stroke, but does not mean that we don't have to monitor them after their competition. So these are some tracing in the core temperature from individual athletes. So we have the individual cycling time trial, right, on the top right or your left. Okay, so you can see from this graph, right, this individual cyclist time trial cyclist, right, he spent more than half the time, which is about 39 minutes above 40 degrees Celsius. Whereas in the road race, there's more oscillation in the core temperature simply because of the pacing strategies that the athlete employ. But right at the end of the race, this cyclist also reached 40 degrees Celsius. Whereas now you look at the graph at the bottom, that's the sailing event, a boat class, where the race is, there's 2 races in one day. Each race is about 30 minutes in the SEA Games format. You can see that in the first race, the core temperature barely goes above 39.5, whereas in the second race, it was a bit higher, right? But at no point during the 2 races, the athlete actually goes close to 40 degrees Celsius. But this athlete actually won the race, right? So factors that associate with high core temperature, longer events, obviously there's a chance of more heat accumulation. So there will be more time spent above 38.5 degrees Celsius, and there will be a greater change in the core temperature. Higher solar radiation also drive up the heat load, and there's a correlation between the solar radiation with the delta in T-core and also the heat load above 38.5 degrees Celsius. But quite interesting in our study, in our monitoring, is that the athletes who perform better actually does not present with a higher thermal strain. But I won't say this is a cause and effect relation. It's simply because that the sports that we monitor during these SEA Games, right? Some of the sports, the level of competition in Singapore, in Southeast Asia, right? We are actually a top performer. Say, for example, sailing. Our athletes are actually the top in Southeast Asia and top 10 in Asia. So that's why the level of competition for different sports is different at SEA Games. Okay? So just a snippet from the Olympic test event. This is when we move from Southeast Asia to the Olympic Games, right? But this is a test event. It's not the actual event. From the same sailor, 2 days of racing. Each day there are 2 races. And the peak core during the first day, right, was pretty low by comparison, below 39 degrees Celsius. The air temperature was 31 degrees Celsius. Wind speed was 11 knots, right? But if you look at another day of racing where the core temperature actually goes beyond or closer to 40 degrees Celsius, right? And the air temperature was actually 28 degrees Celsius. It seems like it's cooler, but the athletes was getting hotter. But you look at the wind speed, it was 17 knots and 60 knots. So in this case, this athlete has to push harder, right? Because of the wind condition. And the other thing to take note is that we take together the ranking that the athlete gained, right? It was actually 29 versus 30 position. So in terms of performance, does not seem like actually when he pushed hard, he actually win the race, right? So it's important to know that even though the weather can affect the core temperature and how hot our athletes get to, it's still a combination of the work that the athlete is doing as well as the environment. So does that mean that better athletes, meaning hotter athletes? So far, we did not find any. the studies out there did not find any correlation. And in our case, because the level of competition in SEA Games, we found a different correlation. Higher core temperature associated with lower positioning in our study or SEA Games monitoring. But it does not mean that, it could mean that there was a greater heat strain in our athletes, meaning that they actually have a reduced heat resilience. It's potentially that our Singapore athletes thought that because they train and live in the heat, they are acclimatized, they don't need to do anything special. But the other thing to take note is that we did not measure core temperature of all the athletes in the SEA Games, meaning the winner of that event could have a higher core temperature. We do not know, right? We only monitor our own athletes at SEA Games. And regardless, we find that there could be an impact pacing in our athletes, especially in the racing sports. And there could be a difficulty in sustaining performance in tropical condition. So the question maybe for us is that we probably will need to try to help our athletes to safely tolerate the heat load and the high thermal load so that they can perform better and safely in the hot and humid environment. Some implication for recovery and training, potential consequences. The limitation of our SEA Games monitoring is that we did not monitor their blood or whether if they suffer from any plasma endothalassemia or any kind of inflammation or immune suppression. So, but we can infer that most likely there will be a greater recovery demand, and also there will be a reduced subsequent training quality. There will be increased fatigue and potentially GI disturbance and dehydration risk. So how do we then help our athletes recover faster after a hot competition? The graph here shows that if you don't cool down the athletes, the athlete will definitely spend longer time above 38.5 degrees Celsius. So the principle is to try and start cooling ASAP, even though our athletes did not complain of any heat-related illnesses. So regardless, we need to help our athletes to prepare for the heat. Before competition, try and put them through a structured heat acclimation program. Even though that our athletes been training in the heat, right? Or training in Singapore weather, they usually will train at the cooler times of the day. Whereas during the competition, they might actually race at the warmer times of the day, right? And we also need to start to plan hydration with our nutrition teams, as well as ask the athletes to try and rehearse their hydration strategies during the competition. Get them to get familiar with the cooling strategies. During competition, don't try anything new. Try to execute whatever they have practiced before the competition. Try to drink cold fluids, ice slurries, external cooling where possible, and also pacing adjustments. So this one I put a question mark is because, right, how are we going to ask them to adjust their pace when their whole objective is to win, right? Maybe for some events it's possible. Say, for example, road cycling and team time trial, the cyclists might actually take turns to lead. And also, like for team sports where there is a rotating substitute, then yes, it's possible that you can actually adjust the work-rest ratio and also adjust the pace. After competition, initiate cooling as soon as possible. Continue the monitoring of the core temperature if possible. What are the research gaps and future directions? So I've shared that 2 studies done on Singapore athletes that shows that tropical heat impairs endurance performance, and heat influence immune system as well as the GI responses. But what is not known of our Singapore athletes is the real-world competition core temperature in Singaporean athletes, sport-specific heat profiles, individual tolerance and recovery patterns, as well as the link between heat strain and repeated training ability. I feel that for most of our athletes, Singapore athletes, when they train in our environment, most of the time their training quality will actually be not optimal, because they will have to train at a lower intensity in order to complete the session, simply because of the heat load. So potentially, we might actually start to get our athletes to train in a cold chamber instead, only for some of the high intensity workout instead of like asking them to train always in the hot and humid environment. Key takeaways: high heat strain is common in elite competition. Some athletes their core temperature can go above 40 degrees Celsius without clinical illnesses, but that does not mean that there's no physiological consequences. Our SEA Games study shows long duration and solar radiation drive thermal load. Better performance may come with a higher heat strain, and we need to be more intentional about training or building up the heat resilience in our Singapore athletes. So with that, I end my presentation. Thank you so much. Thank you. Thank you.
Thank you very much, Dr. Kester. So we will take a 5-minute break. You can help yourself to the refreshments, or you can have a very short restroom break. But we'll be starting again at 3:05 p.m. For those that actually came in a little bit after the... Okay, may I invite all of you to take your seats, please? We'll get ready to start. All right, so hopefully that was a good refresher for everyone here. And for our next speaker, we're taking a little bit of a detour. We'll actually talk about some sports material in Apparel. And I'm very happy to introduce Dr. Vitali Lipik. He is an R&D director at Sportmaster group of companies. He has obtained his bachelor's and master's degree from Belarusian State University in 1999, and then got a PhD through a co-tutel program between the University of Montpellier and Belarusian State University. Right? And then in 2016, Dr. Vitali earned an MBA with a specialization in innovation from the Nanyang Business School at NTU, Singapore. With more than 24 years of experience in academia, of those 11 years in R&D, and also 4 years as a scientific consultant, he's really focusing on different types of biomaterials, especially biodegradable polymers, and how they can be used to interweave into the clothing that we wear. So he's also recently won the Hans Selye second-class medal from the International Society for Clinical Physiology and Pathology very recently for his work on developmental sports tech to improve human adaptation. So today he's going to talk about different methodologies to assess cooling performance. And then he will talk about the cooling performance of textiles, different cooling strategies, including an interesting material called boron nitride additives, and eventually how these advanced materials can be used for sports performance. And with that, I would like to invite Dr. Vitali.
Good afternoon. My name is Vitali, and I try to explain, is it possible to help to overcome negative effect of overheating with some technology related to material science. I'm Research and Development Director of Sportmaster Group of Companies, and today I will present our work in the development of cooling textile and how we evaluate different cooling technology in industry. You will see that our research differs from typical academia studies. In majorities of cases, our search looks like a screening. Okay, it looks like a screening. We don't go deeply, we don't dig the ground to understand the mechanism of phenomena. For our business department, sometimes we work with a black box, and if they can sell something to customers, there is no need to spend time and resources to understand how it works. For example, you can see from this picture that under the sun, few t-shirts don't accumulate heat under the sun, but few have high temperature. If you want cooling, we just take white and yellow t-shirt for sales. And they may contain some technologies, they may contain titanium oxide or barium sulfate, but it's not interesting for business department. If one picture proof property, it's enough for sales. And today I start my talk with cooling mechanisms, then move into environmental impact and measurement approaches, and then deep dive into 4 specific pathways related to heat loss, which we are using in textile: transmittance, thermal conductivity, emissivity, and moisture management. A little bit about my company. Sportmaster is a large company in the sporting goods market with over 2 billion USD in sales. Our business concept is very similar to Decathlon, and headquartered in Singapore, we operate over 640 stores and work with more than 600 manufacturing partners over the world. Our own brands now account for over 75% of total sales, which drive our focus on R&D for technologies like the one we are discussing today. Companies developing passive cooling apparel focus on 5 primary pathways. For example, conductivity, first one. It uses conductivity material like conductive material like graphene or metal to pull heat away. This is quite simple to understand. Moisture management system like CoolMax use fibers which multiple channel to speed moisture to the surface for quick evaporation. And as you know, evaporation of water removes large amount of heat from human body. Transmittance. In simple words, this is transparency of material to infrared emission. The more transparent material to heat, the more heat goes through without accumulation. And dissipation. Heat can be dissipated, absorbed, or reflected. If you want cooling, we are interested in high heat dissipation. For example, you can see here a product for cooling based on heat dissipation, innovative heat gear, and that radiate heat away. And additionally, endothermic reaction and fast changing material are known technology in cooling apparel. When we are developing cooling effect in textile, it will be nice to keep in mind where this effect should work. In Singapore, solar non-irradiance can reach 1,200 watt per meter square. And these graphs at the right side from international standard we use when calculating thermal comfort for human. It shows the amount of heat generated by human body at different level of activities. As you can see, walking human body generate roughly 90 watt per meter square. So we have 2 flows of heat, one from the sun and another from human body, and it's 10 times difference. If I wear a t-shirt with metallized yarn indoor, it will provide good cooling effect because of good heat dissipation. But if I go outside in Singapore in this t-shirt, it will be heat up to 55 degrees Celsius and I will feel like in microwave oven. This is why when we develop in cooling, we should remember to which side we need to fight. If you fight to wrong direction, effect can be opposite. And second simple example, environmental conditions stipulate how channels of heat loss work. You can see easily from this picture that whatever advanced cooling technology in apparel you have, if environmental temperature is above 30 or 36 degrees, nothing works except wicking or moisture removal. To prove cooling property, we definitely use measurement. We need numbers. Some of methods used in textile industry are very unknown to academia. When studying material, we use spectroscopy, checking how material transparent for heat. Emissivity is used to evaluate how effective material dissipate heat. Heat retention methods used infrared light and infrared camera helping to estimate how much heat is absorbed by fabric. When we work with human emissivity, effusivity, very interesting method shows how quickly material transport heat inside, and it stipulates how you feel this surface, cold to hot. When we work with human, we use metabolizer, measurement of speed of blood flow, infrared imaging, heat flow sensor, and classical eye button sensor for skin measurement temperature. We have all this facility in our R&D center in Cleantech. First heat channel, infrared transmittance, allow body heat to pass through the fabric. Not all polymers and not all materials are equal. For example, here you can see that cellulose or cotton can transport only about 70% of heat, whereas advanced polymer like TPX fully transparent for infrared. It's up to 99% of transmittance. If you put cotton, polyester, and TPX t-shirt on volunteers and measure blood flow in resting condition, it looks that fabric with high heat transmittance lead to lower blood flow. It's because of transmittance, maybe moisture management or something else. By experience, we already know that it's very seldom only one heat channel works. Normally, it's a combination of several channels. If we put these 3 t-shirt on volunteers and ask them cycle indoor, we immediately see that TPX t-shirt with high heat transmittance help to keep lower skin temperature. Maybe it's related to metabolic equivalent task as well, we don't know. But you see that TPX t-shirt provide also lowest MET. And for academia studies, this is nice. Yeah, we can confirm that heat transparent material quite helpful, but in real life, it's not so, because when we manufacture apparel, we need to add dye and stuff, dispersed dye or chemical dyes, which will absorb heat, and the transparency of this material does not work. But anyway, many companies now just use pure polymer to create a cooling apparel based on necessary property. Everybody works now emissivity, second heat channel. Everybody works with boron nitride for cooling. It's used in a cooling system of nuclear reactor and quite famous chemical. We also try to use it in textile. From the first table, you can see that boron nitride doesn't accumulate heat at all. On the infrared lamp, its temperature reaches only 29 degrees, whereas other materials have shown 70 or even 80 degrees. It's a good heat dissipator, but good heat conductor as well. Otherwise, but you see that good heat conductivity or thermal conductivity we have only when amount of boron nitride is about 40% or larger. For nuclear reactor is fine, but for textile it's too much. We cannot incorporate such amount of material in textile. Anyway, we try to use boron nitride test in 3 ways of adding: 3% of boron nitride to yarn by compounding, 5% into cotton paste, and 5% into printed matrix. When we tested effusivity, yes, it's clearly seen that heat goes faster into fabric with boron nitride, providing cooling sensation. Then we sewed these samples with boron nitride as patches on t-shirt and had volunteer cycles both outdoor and indoor for 10 minutes. It's a common study how people evaluate cooling property in textile working with human body. Cycling outdoor. Human is very difficult subject to work with. You can see 2 infrared pictures example from 2 volunteers, just example. And what I can see from here, first, we have 2 different set of data, completely different set of data. Second, if I look at the results and I see that printed and coated fabric make difference, yes, we see cooling. But we are not sure whether it's because of boron nitride or because we modify surface of fabric. And it's normal effect when you add something to textile and change surface, moisture management is much better, and you have also cooling effect because of moisture management. Here, I present data collected from temperature sensor placed on skin. Results were clear. 5% boron nitride coated fabric showed the best cooling effect, and after this study we start less using our infrared camera, trusting more temperature sensors. Regardless, the skin temperature results were also complex due to impact of sweating. And you see at the end we come out to the conclusion that fabric difference, surface of temperature of fabric surface and skin temperature, it's 2 different temperatures. Indoor cycling. Indoor cycling and infrared imaging also revealed large difference among volunteers. Why? Because some volunteers start sweating after 3 minutes, some manage to cycle 10 minutes without any sign of sweat on apparel. It's seen from the table that 5% of boron nitride printed fabric revealed best cooling property. But honestly, I don't see on infrared pictures that cooling patches were much different from blank fabric. I don't see patches in dark blue color and blank fabric in a bright red color. All of them more or less the same. When we look at temperature data collected from sensor, we see interesting phenomena here. Best results obtained from blank fabric. I mean fabric from which entire t-shirt was made. We did not think about it at the beginning. It was occasionally done, occasionally measured. We used t-shirt cotton polyester mix designed for gym exercise with good moisture absorption properties. And in general, boron nitride may help outside where we have heat from the sun, but for indoor exercise, simple moisture management in fabric or good sweat absorption works better than any sophisticated coating and printing of famous cooling substances. Now the next heat transport channel, thermal conductivity. It's very easy to understand. If you touch metal, you feel cold. And thermal conductivity impact, many companies try to use it. We also try to evaluate metallized yarn available in the market, hoping that aluminum in this yarn can help with cooling. Our human trial on volunteers sitting in room temperature showed that one type of yarn, MX silver, improved heat transfer from the body by 36% compared to other fabrics. Yes, this is cooling, but we cannot say that it's effect purely from aluminum. Why? Because yarn MX gold is absolutely the same, but just gold pigment titanium nitride was added to this yarn. And at the end, it could be a combination of several factors, including even twist of yarn and composition and placement of this metallic plates in a final fabric. And also we should remember that this is good heat conductor, but if I go outside in Singapore in this t-shirt, it will accumulate heat from the sun and I have completely opposite effect. Finally, let's look at moisture management. Yarn with enhanced wicking or moisture transport property was invented quite a long time ago, maybe 60 years ago. And we look again at this picture, and again, moisture management is only one way to cool down human body in hot conditions. In this study, we tested 4 cooling technology in textile. Our brand the Mix, one t-shirt, number 1 t-shirt with wicking cooling coating to facilitate distribution of sweat and fast evaporation. Second one, it's a top brand with hydrophilic polyester for better moisture removal. Third one, our brand the Mix with xylitol coating. Xylitol is a chemical absorbing heat during the contact with water. And another top brand, number 4, it's a t-shirt with advanced yarn with cross-section containing microchannels for better moisture transport. To test this t-shirt, 10 volunteers performed 27 running trial, including 10 minutes initial run, and after that, several cycles of high-intensity interval training. We measured skin temperature, body weight, t-shirt weight, blood flow velocity before and after the run. Using 8-point skin temperature method, we found that the Mix number 3 t-shirt containing xylitol consistently resulted in a lowest change in skin temperature throughout both the steady state and high intensity phases of running. You can see the lowest results. We also measured post-exercise blood flow in the brachial artery. Lower blood flow velocity after exercise, as seen with the Mix t-shirt, indicate reduced cardiovascular strain, as the body isn't working so hard and blood as hard to pump blood in the skin for cooling. Body weight loss also was lower for t-shirt with xylitol, meaning that less water was evaporated during exercise and t-shirt did it works for cooling. But I should point that regardless of these numbers, good average numbers, statistics is weak. For good results, for good statistics, we need to include more volunteers in such study. In summary, regardless of my skeptical attitude to xylitol at the beginning of this study, the results revealed that this technology works and helps for cooling. Absolute value of skin temperature don't differ a lot, but if you compare difference of skin temperature increase in percent, We can get good numbers for marketing department because marketing, they don't like statements that our technology provides 0.1 degree less skin temperature increase versus our competitors. They like that our cooling technology provide 48.1% lower increase in body temperature than brand one at the 10 minutes mark and 37.5 lower at the 27 mark. Here you can see also an attempt to promote this technology as energy saving for sportsmen. It's quite easy to get the idea. In our t-shirt, your weight loss is smaller and it's normally evaporated water, which is leaving your skin taking some energy needed for evaporation. Yes, this is energy for cooling, but it's still your energy. If in one t-shirt you are sweating less, theoretically you save more energy for your muscle. And also, we see that t-shirt with better cooling property provide also lower blood flow, indicating reduced cardiovascular strain. Thank you for your time and attention. I hope that our screening study were easy to understand and maybe some idea from here will be used by you for future study and product development. Thank you.
Thank you, Dr. Vitali, for the fascinating talk. So for our last speaker, we are very privileged to have with us today Dr. Fabian Lim, who's been a pioneer in the field of exercise and sports science in Singapore and also a mentor to many of us in the field. He is the program director for the graduate diploma in sports medicine at Lee Kong Chian School of Medicine, NTU, and which has led since 2018 in collaboration with the Changi General Hospital. All right, this program is actually endorsed by the Singapore Medical Council and aims to enhance sports medicine knowledge and skills amongst doctors in primary care settings. Now, Dr. Lim is also a visiting distinguished professor at the College of Health Sciences, Vinh University, Hanoi. And he was most recently, last year, recognized as a top 2% scientist by Stanford University in Elsevier. Throughout his long and distinguished career, he has also pioneered human physiological research in the Singapore Armed Forces and translated many of his findings to social health, safety, and performance. And he was also the founding executive director of our Singapore Sports Institute, where he charted the national strategy for athlete development pathway. So for today, he's going to be discussing on the current evidence in exertional heat stress and injury. And I hope you join me in welcoming him to give us a very fascinating exploration of a dual pathway model of heat stress. Dr. Fabian, please.
Thank you, John Ming, and thank you everyone for being here, and even including those online. I'm supposed to stand here so those online can see me. So good afternoon, and it's very privileged to be here. First, welcome to LKC. To formally welcome you here. We're very privileged to host this seminar together with the Sports Medicine Association. My challenge for the talk today really is that when we talk about exploring current evidence or evidence on heat stroke was to really size down the number of slides I have or have to present, because the reality is when we talk about heat and heat stroke, you're talking about a disease that's more than 2,000 years old, right? The first recorded case of heat stroke is in the book of 2 Kings in the Old Testament in the Bible. And if you go back to military history, there's records of heat stroke happening all this time, from before Christ to the early centuries of human existence and so on. And along with that, there's a lot of dogmas that has been formed, because every time you see a heat injury case, the person is hot, right? And therefore, heat is the cause of heat stroke. And that has been the mainstream thinking in textbooks, in medical schools, and so on throughout. And today, there are a lot more evidence that comes out. You must understand that when you perform or exert yourself physically in the heat, heat is not the only stressor. Exercise is the other stressor as well. There are multiple stressors that affects your physiology that ends up in the state that you're in. And in science, when you see an attribute happening beside another attribute, it is not necessarily causal. That's the basic I want you to understand, right? When I'm hot and I collapse, it is associated with heat. It does not mean heat causes me to collapse. You understand that? Okay, so that's the first understanding you need to understand when we talk about what we observe, all right? And there's a lot of evidence that has changed. In the last 30 years, 50 years, I contributed to some of those to look at the broader perspective of the effect of heat on the human body and to reinterpret heat, the impact of heat on the human body. But because this thing has been drilled into the minds of, from bureaucrats to the way medical doctors are trained in med school and in the army and so on, it's very hard to change thinking. So I hope to do today in a very short period of time is to present to you some of the evidence, related evidence. Just to give you a snapshot, there's a lot deeper discussion beneath what I'm going to talk about. But if you want to discuss more after the session, I'll be happy to discuss with you. To the point that just at the beginning, we were bargaining between 20 minutes and 30 minutes. So John Meng will stop me when it's time to stop. Yeah. Yeah, so that's the title of my talk. And if we want to summarize the evidence today, this would be the best set of literature because it's fresh. It's published, there's an opinion published in 2025 on defining the limits of heat load. How much heat can a human tolerate? And Abdul Razak Bukama is a veteran in heat stroke research, heat injury research, because he worked in the Saudi where people go from Mecca and there are a lot of heat cases over there. He has a lot of chances to look at them. So he's one of those in the forefront of that. And along with that, there were a few comments and rejoiners and a lot of debates that went on even to recently in 2026. So this summarizes the current state of thinking in how much can human tolerate. I just want to go back to this where the proposal is this part, that's how he proposed to look at heat load tolerance. And not to go into detail, basically it's a reworking of the physics of heat transfer. How you absorb heat, how you produce heat, and how much your body stores heat. Back to the story of heat in the body. Plus a buffer. Buffer again is how the cells is able to balance heat generation and heat removal. So basically it's still very much talking about heat. And to summarize the discussion, they define heat tolerance and thermotolerance differently, which I find it quite confusing because linguistically they mean the same thing, right? So heat tolerance is the heat load that your body can tolerate before temperature starts to rise quickly. Okay, we call this the point of uncompensable heat stress, right? Your removal falls behind production, right? So your temperature starts to go up. So that's defined as heat. When you reach that point, you're heat intolerant. Okay, so thermotolerance refers to the same thing at the cellular level, that's all. Okay, and that's basically how they look at it. So essentially, it is still how much your whole body as a whole produces and how much your body as a whole can remove heat, all right? And the thinking is they looked at heat tolerance as a static thing, meaning that if basically they've observed that heat injury occurs between 40 and 43 degrees. And within that, if you are in between, then that is individually, that's your level of heat tolerance. What they don't take into consideration is the change in the state of health, the change in the state of physiology, especially with exposure to hard training and exercise and so on, right? There's no reference to the pathology of heat stroke, meaning that there's nothing to look at how does a heat stroke victim looks like in the emergency room. How does a heat stroke victim look like, in pathology report when they open up the body and so on? The only thing that they looked at, high body temperature. That is the state of how the understanding of heat, the impact of heat on the body is today from a scientific point of view, and that influenced medical practice. Okay, and essentially what they're looking at, when you look at thermal balance, you're basically looking at what is called thermoregulation, how your bodies regulate the temperature. Keep your temperature low as you do whatever you're doing, which is a different concept from thermotolerance, how high a temperature you can tolerate before your physiology gives way, before you collapse. All right, so that summarizes for you the state of understanding of heat injury today with regards to scientific evidence. And where all this comes from is that whenever we observe a case of heat injury, it is usually there. For heat exhaustion, it's in the high 39s to the low 40s, 39.8, 39.9, and to the low 40s, right? That's heat exhaustion. And then heat stroke usually occurs above 41 degrees and above. The highest in the literature is 46 degrees Celsius, and the person survived. Okay, the person survived, all right? And because whenever we observe heat victims, they're hot. The thinking is that heat causes heat victims. But in science, we're supposed to look at things both ways. What about those people who are hot and don't get heat injury? Okay, today there are lots of evidence that shows athletes performing up to close to 42 degrees with no symptoms of heat injury, no symptoms of dyshomeostasis in the body, no impact. And we are one of the contributors to this set of data. All right? So this is the issue that we are challenged today. So in science, when I take a drug, it works so many percent of the time, and then I give a same intervention, it didn't work so many percent of the time, we call it unreliable. In other words, up to 42 degrees, heat is an unreliable predictor of heat injury. The same person at 41 degrees can be well today. The same person at 41 degrees can die of heat stroke on another occasion. And this is something that a lot of literature in the textbooks and what people teach do not take into consideration, right? They only look at the positive, they never look at the negative. In fact, I will show you data, majority of the time, you get people above 40 degrees, nobody having heat injury, right? Today, the IRB ethics, previously ethics used to approve the limit. When you do research, you cannot go across 39 degrees Celsius. Today, because of the data we have produced, ethics is now approving at 40 degrees Celsius. Because we are confident that up to 40 degrees, it's almost impossible to get heat injury unless there's some condition. I'll show you what they are. So the important thing is to separate between thermoregulation, which is how well your body can balance between heat production and heat absorption versus heat loss, and thermotolerance. So when we talk about thermoregulation, is the slope of your temperature increase, right? How fast does your temperature increase when you work? When we talk about thermotolerance, is along this axis, how high a temperature can you tolerate before you collapse? That is the difference in concepts. One is on the horizontal axis, the other one is on the vertical axis. They are two separate conditions. The problem is today, a lot of people are still using thermoregulation. What is your temperature now? To prevent the moderate risk of heat injury, which is not the cause. That is the reason why, after more than 2,000 years, we are still getting fatalities, because we are not treating the cause of heat stroke. Okay? So I will talk about performance first, the first set of my talk. I have until 4 o'clock. Is it? 4? 56, wow, okay. I'll talk about impact of heat on performance first. The first thing, it is true, what the other speakers said, I concur with them, that high body temperatures impairs performance, okay? But if you reverse that, it means that if you can regulate your body temperature well, then your performance can be good, right? And this is founded in two concepts I don't have time to go into today. you can go read about it. It's called the Central Governor Theory by Tim Noakes. Go and read about it. Second one is the critical core temperature concept, all right, in the literature, right? If this is the case, then if you are able to regulate your body temperature compared with the other athlete, then you're at an advantage, isn't it? And how do you gain that advantage? Heat acclimatization. Your body has the ability to adapt to perform at high temperature, right? This we're talking about performance. And this is a set of data that was published by my honors student. We brought in people to run in a chamber, one run at 70% VO2 max for 1 hour in cool condition, another run in hot condition, 35 degrees. The other one was 25 degrees or so. And we published this in 2013. So this is the body temperature, the core temperature response. When they rested, no difference between cool and warm. And then when they ran, the body was able to defend the heat load for up to about 25 minutes. After 25 minutes, you see the effects of the effects of the heat, the different temperature, the different environment on the physiology, right? But if you look at heart rate, right? The increase in heart rate over here was similar due to the effects of the run, and both groups increased similarly. And even though, and the reason why your body temperature could maintain at this level was part of it was because it's compensated by a higher heart rate. The heart was working harder to pump more blood to the muscles, and from the muscles to carry the heat to the skin and to dissipate it out of the skin. All right, so the heart compensates. So when you exercise in the heat, you put strain on the heart, and that is why performance drops, okay? But beyond that, beyond 25 minutes temperature, even though heart rate was higher, I was unable to control the rise in temperature. Now, this is a field study and a very interesting study that was done in Africa, where they compared Caucasian runners and African runners, right? They did a treadmill run for 30 minutes, and after that, they did a time trial. This is on a treadmill, a time trial for 8 kilometers at under 2 condition, right? The first condition was cool, and if you look at the performance between the two groups, they perform about the same. Okay, all are elite runners, about 27 minutes for 8 kilometers. But when the same group of people perform at hotter temperature, look at the difference in performance. The African runners dropped their performance by about 2 minutes, but the Caucasian runners were slower by more than 5 minutes. All right, and the understanding from this experiment is that because of the difference in weight, different in size, when they ran maximally, the heat generated was a lot more in the Caucasian runners who were heavier. And because body temperature was increasing quicker, right, the brain was slowing them down in order to balance between what the body produces and what the body removes. So, right, so the brain controls. The brain has a big impact on your pace when you run in the heat. There are a lot of other data I don't have time to show you, but this is the concept today, all right? What about heat acclimatization? This is a very nice study where these are cyclists who were training in the Middle East, and they perform under temperature of 36 to 37 degrees Celsius. This is outdoor temperature, right? And they did 3 time trials. In between, they were heat acclimatized. They went through heat acclimatization for 13 days, every day cycling in that condition for 4 hours, right? And they measured their temperature and performance. This at time trial 1, there's no heat acclimatization. Then on 5 days and 13 days of heat acclimatization, and they compared them with an equal group of athletes who were performing in cool condition under 8 degrees Celsius. All right. In terms of power output, you can see this is the control group at 8 degrees Celsius. This is at baseline when there was no heat acclimatization. This is cycling power output over time of the time trial. At 5 days, you can see that there's improved. On 13 days, power output has caught up, almost caught up with the control group. So this is the effect of heat acclimatization. This is how much our physiology can cope, can adapt to performing in the heat. In terms of body temperature, this is trial 1, which is no heat acclimatization, and this is after heat acclimatization. At the same workload, you have a lower body temperature. What is more important is this, performance. Before heat acclimatization, the performance at the time trial was, this is cycling 43 kilometers, 1 hour, 17 minutes. After 5 days, it went down by about 6 minutes to 1 hour, 9 minutes. After 13 days, it went down to 1 hour and 5 minutes, almost which is better than the control group, which performed the same time trial at 1 hour and 6 minutes. So if you are an elite cyclist, to gain 6 minutes in 13 days, you know it's quite impossible, right? Just purely by training. But this is the effect of heat acclimatization. So it is possible to perform under the heat if you're able to acclimatize systematically, all right? I will now move on to talk about heat injury, all right? So there are, if you go to the literature, there are 4 types of heat injury: heat cramps, heat syncope, heat exhaustion, and heat stroke. I don't have time to talk about the first 3, but just to make a statement that both from a physiological point of view and medical diagnostics point of view, the first 3 do not meet the criteria of heat injury. They are just hot. When that happens, they are hot, all right? But heat is not the main cause of the first 3. Okay, the 4th one is a clear-cut heat injury, heat stroke, all right? Because the mechanism I'll explain to you in a while. And the main feature, as mentioned by Teoju earlier, is the central nervous system changes, right? You're disoriented, you're talking things that doesn't make sense, and some of your mental functions do not work. So I've published most of what I'm going to share with you is in these 2 publications. The first one is the one that I created a new model, a new thinking about heat stroke, right? There are 2 pathways that cause heat stroke. One is due to heat, the other one not due to heat. And then I've updated them again in my second publication over there. You can look at it in 2018. So the early models of heat stroke are here. This is 1924 and then 1946. I don't have time to go deeper into it, but basically it starts with heat, leads to water loss in the body. So there's drop in your blood volume. There's, because when you sweat, the fluid from sweat comes from your blood, plasma in the blood. And because there's not enough fluid going around the body, the cell starts to break down, and so the organ starts to fail. And that's what you see in heat stroke. But today, when you understand the physiology of heat stroke, it's a lot more than that. Okay, that doesn't explain heat stroke clearly. Now, if you read the pathological report, one of it from Singapore, from the late Professor Chow, you see that the clinical presentation of heat stroke victims is very similar to a sepsis patient without heat stroke. Right? The kind of things that you see: systemic inflammation, disseminated intravascular coagulation, there's hemorrhages, and the cell starts to die, the organ starts to fail. Okay? And before me, there are other people who suggest that heat stroke could be due to an infection rather than to the effects of heat. Right? But we know that at some point, the cells will disintegrate. At some level of heat exposure, the cells will disintegrate and still cause end organ failure. And I'll show you the evidence around this now. The first thing is to help you to recognize that humans can tolerate up to 42 degrees under normal health condition. If you're a healthy individual with no sickness, normally you can tolerate up to 42 degrees with no consequences. We are the first to publish continuous core temperature monitoring in an endurance run. In this case, it's half marathon. And there are many things I can tell from here, but I'm just going to tell you that about 40% of the 18 runners had body temperatures above 40 degrees. The highest was 41.7 degrees. And none of them have any symptoms of heat injury. Okay? And this has been reprinted in somebody else's book to prove the point. Then this was in the 2003 marathon. We went back again and did the same measurement in 2007 half marathon. And there again, out of 30 runners, at least 30 to 40% had body temperatures above 40 degrees. Highest was 41 degrees. And again, you don't see any heat cases. So most of the time, we can tolerate it, right? My most recent one I collected last year. This is in group of firefighters who were performing their tasks in protective suits. And about 36% had body temperature from 40 to 41 degrees. Another close to 10% had body temperature from 41 degrees to 41.8 degrees. So almost 40+% had body temperatures above 40 degrees. And these are people who do this as a career. Every year they do this in and out. It's not the only time that except that it's the only time we measured them. Right. So this is the thing that I want you to bear in mind. So based on this, I created this model called 2 pathways of heat stroke. Below 42 degrees and above 42 degrees. Below 42 degrees, if you get heat stroke, it's more likely due to what's called endotoxemia. There's bacteria in the blood that triggers an infection. Above 42 degrees, endotoxemia can still happen, but above 42 degrees alone, the heat alone can disintegrate the cells and damage the organs. All right? And where does the bacteria come from? And there's overlap. So the bacteria comes from the gut. So like now when we are seated down and rested, we have millions of bacteria in the gut, the good and bad bacteria. Okay? And when we are seated down, those bacteria are kept separate from our blood flow. They remain in the gut. The problem is when we exercise, the permeability of our gut increases. And this is well proven, right? And when the permeability increases, the bacteria crosses the gut barrier into the bloodstream. Now, normally, if you are well, if you are healthy, you don't have any illnesses, right? The body can manage that, and you finish your training system, you finish your training with no problem. This is what we see in 41, 42 degrees with no heat injury. All right? The problem is when you do the same thing and your immune system is suppressed, is compromised. All right? And so when you do the same thing with immune system that's compromised, you're unable to cope with the influx of bacteria into the blood. And over time, that can increase to a point where it triggers a septic response, a systemic inflammation. And that is what we see in heat stroke victims. So the immune function acts as a switch. In the same person, if you're well, you'll be heat tolerant. If you're unwell, you move down the other pathway into heat intolerance. This is below 42 degrees, by the way. And we know that there are many circumstances where you can be exposed to heat with a suppressed immune system. A prolonged period of endurance training is one. Immune suppression happens, right? You have a subclinical infection, you do not know. You just come back from a bout of infection, and you're just starting to train again. And these are the circumstances, I'll show you evidence that increases your risk for having heat stroke. I'll run through the evidence very quickly. This is, again, a paper published by Yichie, my honor student, where we expose people to heat and cold, and we measured Claudin-3, which is a biomarker for gut permeability. All right? So you can see that this is pre-exercise, post-exercise, 2 hours post, and 5 hours post. In the heat group, during exercise, there's increase in Claudin-3 in the blood, meaning that during exercise, your permeability increases. Whereas for the one that run in cool condition, the increase in permeability happens during recovery. But even though permeability increases, you only see increase in bacteria in the blood in the hot group. So when you run in the heat, you do see increases in bacteria in the blood, and your gut permeability actually increases. So we were one of the first to show this, to measure this and show this. This is a very nice experiment done in Canada, where they took our model and same thing, they exposed people to heat stress, and they took blood at temperature points, 38, 38.5, 39, 39.5, and so on. They tested one group who is aerobically trained, another group who is untrained. You look at the top, so these are the temperature time points. So in both groups, the bacteria in the blood increases, but in the untrained group, from 38.5 onwards, you see an acute increase in bacterial count. And that is why fitness is one of the risk factors for heat injury. Okay, the bottom marker is LBP, LPS binding protein. That is the receptor that binds to the bacteria at the cells, right? So that's how bacteria gets into the cell. All right. So here you see that it's associated with heat. As you exercise, as your level of heat stress in the body goes up above 38.5, you can see an acute increase in bacteria. This is data published by another honor student of mine in the second half marathon that we did, and out of 30 runners, 25 have an increase in bacteria count in endotoxins, or bacteria in the blood, after the marathon. Before that, you don't see that, okay? I'll just quickly run through this animal study. I know I'm running late, out of time, where we subjected animal to heat stress alone, heat stress with turpentine injection. I injected turpentine into the muscle to induce inflammation without bacteria. And I injected dexamethasone, a steroid, which binds to the bacteria. It controls the bacteria. The fourth group is a combination of turpentine and dexamethasone and steroids. The first graph shows you survival. The group that is steroid alone, when you control for bacteria, 100% survive. The other groups, 30 to 60% mortality, died of heat stroke, right? If you look at LPS, this is bacteria in the blood. The bottom line is the control group with no heat stress. The top line is the group that exposed to heat stress. You see, in all groups, there's an increase in bacteria in the blood, except for the group that survived 100%. When you control bacteria, survival rate is 100%. I'm not the only one to show this, everybody. The Africans have shown this 20 years before me in monkeys. Others have shown it in dogs. When you, unlike temperature, which is not consistent, LPS is consistent. You block LPS, you block heat stroke. Okay? Yeah, I don't have time to go into detail. In this group, and this is a marker for organ damage, all increased except the group with steroid injection when I control for bacterial count. And this is inflammatory cytokine, right? Indicator of inflammation. Again, increase in all except the group that survived 100%. I'll just finish off with epidemiology study, and this is important because then this is real humans, where real humans comes in. These are 12 years of medical record of heat stroke patients in a Thai military hospital, 29 victims. I'll just quickly summarize it for you. Of the 29 victims, 95% had a bout of infection prior to heat stroke. Of the other 5, and there were 4% or 3% where they had some intestinal disorder before the heat stroke. All right. Yeah. And the latest, this is really latest because it's pre-published. I received this from New Wash, who just finished, and this is going to be out in Medicine and Science, in Sports and Exercise in the next few months. So you're getting the data ahead of time. They measured body temperature and monitored heat injury cases in 807 recruits in the UK, who marched for about 10 km in 11 degrees Celsius WBGT. Quickly, just to help you understand it, this is about 1/3 the level of heat stress we face. This is in spring and fall. So very, very cool condition. So first message, you can get heat stroke, heat injury, even at WBGT 10 degrees. So the environmental temperature is not your predictor. if you're still using body temperature to predict, if you're still using environmental to predict, you are looking at the wrong indicator. All right? And then they look at their cold symptoms 3 days before the march. -3, -2, -1 on the day of the march. Day 0 on the day of the march. Okay? And they classified them into 2 groups of heat injury. There were 118 cases of mild, which is like your heat exhaustion, right? 15%. And there were 5%, 40 cases of heat stroke, which is serious. 98% of them had organ damage. All right? And what is the risk factor? Firstly, there used to be this thinking, if you have heat injury before, then your risk of heat injury is higher. All right? If you look at this, these are people who had heat injury 2 years before. And if you look at it, no heat injury, the number of cases is higher. Mild heat injury, the number of cases is lower than this, but still higher than heat stroke. So there's this in heat stress research, there's this thing called heat shock response. When you expose yourself to a bout of heat load, sublethal heat load, your body produces heat shock proteins that protects the cell against a higher level of heat exposure. So in this case, it could be the previous bout of heat injury would have increased the tolerance at the cellular level because of the heat shock response. Okay? What is more important is this. If you had cold symptoms on the day of the march, -1, your risk of having heat injury is between 3 to 4 times compared to someone without symptoms. So there we go. It is associated with infection. These are common colds, okay? Symptoms of upper respiratory tract infection. And they look at 0 itself. If you have it on the day of the march itself, your risk of having a heat injury is about 3-fold. Okay, so I hope I have shown you enough data. Now, I'm not saying that, go heat yourself up and so on. You still need to protect yourself from people. I'm saying that when you now try to understand risks of heat injury, you try to moderate the risk of heat injury, you try to prevent heat injury, don't just look at heat. Look at the health of the person in total. Not just on the day itself, because an infection don't happen just on the day, right? Your immune suppression takes weeks to happen. Okay, you need to look at lifestyle and so on. These are cases of heat stroke that occurred and they're no longer around, unfortunately. They're classified as heat stroke, and I'll tell you why. Again, they're clearly heat stroke, but the idea that it's due to heat alone is wrong. This guy, he got heat stroke when he was running his 2.4 kilometers run. 2.4 kilometers run is a 10-minute run. How do you elevate your body to 41, 42 degrees in 10 minutes? It's almost impossible. And it was found out that he kept mum about having a fever, infection. Okay? This guy died of heat injury. You know where he died of heat injury? Not during his training. He was training in Pulau Tekong, the island. He got his heat stroke when he was in an air-conditioned ferry moving from Pulau Tekong to mainland. How does your body temperature go up to 43.5 sitting in an air-conditioned ferry? But he's classified as heat stroke. And why is this important? Because when you classify everything as heat, it drives your downstream behavior. It drives your downstream focus. Let's prevent heat. Let's stop heat. Let's cool the person. Keep our army cool. But there are many other things that's happening that you're looking at. Okay, this is the problem we have with our community today. Right? This guy, he died. He's the most latest guy. During an 8 kilometers march as a guardsman. Guardsman is a second-level elite soldier in the armed forces. 8 kilometers march. As a recruit, he has done at least 16 kilometers. Why at 8 kilometers? Why at 16 he didn't get heat stroke? The same person at 8 kilometers, he had heat stroke. Right? And if you look at athletes, usually they've done the same thing before with no heat injury. There's one guy I didn't have show you here, a young man, during warm-up in a rugby match, collapse of heat stroke and died. Okay? So I'll leave you with that. I hope I didn't confuse you even more. But the point is to take a broader view on what is heat and the impact of heat on the body. Thank you.